I founded Imovis many years ago as a young medical resident, and now we have 65 employees offering 6 different clinical research services. All our services have one thing in common, which is that they focus directly on the patient. This includes, for example, the study site, where we do outpatient clinical trials in many different indications and in all phases of clinical development. Our current focus is on phase 2 to 4 studies, but we also have demonstrated our ability in phase 1b studies. With our 20 years of experience, we can conduct clinical trials in over 120 indications, from alopecia areata to herpes zoster. We are very professional and passionate about our work. What I like most about my work is the variety. The many different skills that I've had the opportunity to develop here, as well as the general medical variety, which unfortunately wasn't covered in my studies. Now, with every new study and new indication, I'm always learning something new. The study site employees form a very special team, characterized by their cohesion, with excellent quality and patient safety always in mind, and being able to give their best every day, with a great deal of joy from their work. Currently, we work hand-in-hand with 5 physicians, 1 psychologist, 2 project managers, 11 study nurses, my assistant, and me. For example, we had a very exciting project last year where we managed to recruit 360 patients within 3 weeks for a vaccination study. In this case, not even a minor finding could be found. That means we delivered absolutely outstanding quality. Then down the road, we added the Flying Study Nurse service, which we use to provide Imovis site support for other sites in German-speaking countries. With our home care visit service, we organize home visits and clinical trials in 16 European countries. The Home Visits Department has been around since 2012, and our team is based in Berlin. From here, we take care of home visits and clinical trials all over Europe, in collaboration with home visiting staff who can, for example, be nurses. We are an international team with experience in different areas of clinical trials and clinical research, and we always work closely together to make every study and every visit a success. We're very proud of our work and how it contributes to the success of clinical trials, as through home visits, we give every patient group the opportunity to participate in this study. Not only can this make it much easier to recruit patients, but it can also lead to a lower dropout rate during the trial and better compliance. With our patient access group, we offer recruitment campaigns as well as conducting telephone visits and virtual visits for other sites in German-speaking countries. Imovis has been successfully recruiting study participants for 20 years, so we know that recruitment can be a big challenge. In general, everything that has to do with advertising, writing the texts, designing the ads, that takes a lot of time. And that's where we come in with our patient access group and helping other study sites with recruitment. We have a very large database of over 20,000 patients. I believe that this personal contact, which is so important to our concept and philosophy, is very well received. I've never been a person for hierarchies. I also try very hard to pass on to the employees in my company that we have a very flat hierarchy so that each person can live out their creativity and can work in a way where they can bring out their strengths.